Within a remodeled block of the Doña County Detention Center, Jason Duran and his team of mental health specialists are working to serve the 71% of inmates in need of care.
Many of our patients haven't received any care until they come here with us. That is why it's our mission to continue to provide the same level of care that anyone would receive.
45% of the individuals under the care of Duran's team of 9 rely on a combination of medication and counseling. According to Horizon Health, the organization contracted through the county to provide mental health care. No individual is receiving medication for mental health needs without some form of counseling. The high number of individuals in need of mental health care while incarcerated is a trend seen across the United States. According to a U.S. Department of Justice report, 44% of jail inmates had some type of previously diagnosed mental health disorder, higher than the 37% seen in state and federal prisons. Horizon Health CEO Sarah Tershwell says the most challenging part of treating individuals within systems like the Doña County Detention Center is that their mental health needs have largely been ignored prior to incarceration.
Why has a county jail in New Mexico become basically a de facto mental hospital? Why? Because we at some point decided that we were not going to provide a safety net for people and give them the mental health treatment that they need.
Duran says his team sees a lot of previous patients return to the detention center, despite efforts to connect individuals with resources. Micah Pearson, the executive director of the Southern New Mexico branch of the National Alliance on Mental Illness, is working with Doña County to find solutions. In a longer conversation about mental health, Pearson told KRWG NAMI Southern New Mexico is in the last stages of negotiation to provide peer navigation services.
My favorite program that we are working with the county to implement, which is peer navigation services, which are independent from any particular behavioral health provider, a team of folks who will go meet a client where they're at and figure out do a needs assessment. We watch this person, we make sure they get from point A to point B, we see everything that's happening.
While there aren't enough resources at the county level to fund Pearson's entire proposal, he says the next step is looking for other funding sources.
Everybody says we need a thing, but nobody wants to pay for it. The county actually really does want to pay for it. They just don't have those funds. But that's the thing. Everybody says it's important. Nobody really wants to put their name on the checkbook. And partly because that requires rethinking the system. And in some cases, you are taking money out of some budgets to put it into another.
Pearson notes that the city of Las Cruces could be one potential funding source, but that conversations still need to occur. And NAMI Southern New Mexico isn't the only entity working to enact change. Horizon Health says they are advocating this year to expand their Release with Care initiative nationwide, including expanding services offered in Doña County.
What that initiative does is for addicted individuals, we give them a 5-day supply of medication. Because when somebody leaves, they're not necessarily going to figure out everything that they need to figure out by the time they actually need that medication.
Above all, those like Jason Duran, who work at the Doña County Detention Center, want the community to understand that while big change is needed to provide better mental health treatment nationwide, it's the small victories that mean the most to staff.
What drives me is knowing that the work that we do within the detention center does help to improve lives, and it helps to improve those individuals that our other folks might forget about. When we have our small victories, it means a lot, because little small victories over time add up to huge accomplishments.
For KRWG Public Media, I'm Madison Staten.